Clinically isolated syndrome, or CIS, is a bit of a subtype of relapsing MS. So the way that you can think about MS is you can think about it like a continuum. We have patients who have almost silent MS, where their MRI would show MS, but they haven't had symptoms yet. And we do find patients like that sometimes. They got an MRI for something else, and we see, surprisingly, that it looks like MS. That would be CIS, or clinically isolated syndrome. So they've only had one relapse and then a very mild MRI. So most people, when they come in, even if they have one symptom, we have evidence on their MRI that there has been other attacks that were silent. And so we usually call most people MS from the first attack. But some people, they don't have enough lesions on their MRI that we can give them the full diagnosis. So we call them clinically isolated syndrome because we know it's part of the same condition. It's just that they don't have enough to show for it yet. Clinically isolated syndrome is treated almost identically to multiple sclerosis itself, and that's because we have multiple trials that show that if we treat a person with clinically isolated syndrome, they're less likely to develop further manifestations of MS, and they do better. And so we treat them the same as we treat an MS patient. And the goal is that once we put a patient on a treatment, we don't want them to have any new lesions or any new relapses.